So my name is Dr. Obadiah Moyo. I'm the Chief Executive Officer of the only ISO certified public health institution in Zimbabwe. Chitumbu is a central hospital. We have piloted the e-government system, and we are the health pilot in government. The very first, all the equipment that we've got, the software that we got, it was also as a result of the support we got from the Office of the President and Cabinet. And we went live after training all the members of staff, getting people together, getting all the other doctoring colleagues, to pay attention and learn about the software. That was the biggest issue, really. But we managed to get through all that and got everybody trained. We went live on July the 10th, 2013. We managed to get all the demographic systems in place. The SAP program is a fantastic program. It covers everything that is required, for the purposes of eHealth. I'm not talking here as a salesperson for SAP, but I'm talking as someone who have utilized the program and found it to be very, very friendly. It's a user-friendly program, and we see that that is a program that will help us to achieve the digitalization of the whole hospital. See, we are talking of digitalization in patient admission, in the billing systems, and also in the diagnosis process. We are looking at a system where the patient arrives, the demographics are entered into the computer, and the information is sent hospital-wide to all the various stations, including the casualty offices, the laboratory departments, the intensive care departments, all the wards, they have that information. And the patient then moves to the next stage, which is the interview with the doctor and the nurse in charge. The nurse will be sitting there, taking all the details with the computer, already trained. All the BPs, the observations are entered. The doctor is carrying out an interview. Information is captured on the computer. He orders, the doctor, he orders X-ray requests, he orders laboratory requests, right? Or admits the patient. And that process is picked up at the X-ray department, and the X-ray department is able to carry out the relevant X-ray diagnostics, send back the picture to the monitor, the doctor reviews the X-ray, instead of having to hold, remember the traditional X-ray films, you see, it's all done on the computer, and you have a permanent record there. Likewise, the results, they also come streaming, and the doctor is able to see. On the wards, likewise, the nursing staff holding their, not MacBooks, but they'll be holding their iPads, and they will have to be able to capture all the information. The doctor is giving instructions. The instructions are captured on the iPad, and it's downloaded to the server for safekeeping and for the purpose of instituting the instruction. Go back to the iPad, all the information there, give the drugs, and it's done. So every area, medical records have been made simple. And being an ISO certified institution, I say that at the beginning, for a reason. We realize that ISO certification comes with documentation. ISO is about documentation. Everything that you do has to be documented. All the procedures that you use have to be documented, and they have to be standard. We don't want a situation where you get nurses throwing injections, like they are targeting, sending an arrow, You know, it has to be done gently. You know, let them feel it nicely. So it has to be documented and it has to be standard. She's enjoying it. It has to be standard, Mr. Chairman. You know, so that is the advantage. So everything now is on computer, on that same program, on the SAP program. All our procedures are now, instead of handwriting in books, we have everything on the computer. So you open your computer, you enter your admission records on the ward, you know, and anything that is being done to the patient is being done. So it's a complete circle, Mr. Chairman. I also want to advise the gathering that besides just working on the SAP, we've also gone one up by engaging the mobile network companies like Net1 and Econet. And their system are also going to be able in future to be able to link with our SAP. And how are we using them? We're using them for the purpose of general public health messages, right? You know, it's malaria season, we send out malaria messages. How to prevent, treatment, that type of thing. It's bilharzia, send out that message. HIV, very soon you'll be seeing some scary messages on your phones at midnight saying, be careful, that woman you're about to take to bed is HIV positive. Or be careful, that man you're about to sleep with is HIV positive. If at all you have to do it, please use a condom. You see, scary messages. And also that you need to say, please go off, go away. And you refrain from it. You see? And you become a good husband, and you become a good wife. We are discouraging, you know, promiscuity. You see? So that will come through the mobile networks. And at the same time, we also utilize the mobile network platform for the purposes of controlling and running our clinics. Like for instance, the antenatal clinic, all the mothers who are coming, you know, will be able to say, your next appointment is on such and such a day. A message is then sent and they are reminded of their appointment. Your medication, please don't forget to take your medication. You're supposed to take this and that and that and that. And in future, we are also looking at the patients going to the laboratory, have their tests done, and the laboratory will be able to send the results to the clinician who will then manage the remote patient, you know, through the mobile system. So there's a lot, you know, I'm just giving you a brief read, you know, it just highlights, you know, of what we are already working on and what we want to do in the future. So the future of eHealth has commenced at Chitungwiza Central Hospital, but we don't want it to stop just at Chitungwiza Central Hospital. We're also talking of telemedicine. We have a system where the doctor will report from a remote area, and we want that to be able to be done in all the district hospitals, all the provincial hospitals where there are no specialists. Information comes from there, reported at the central hospital, and sent back, you know, to the clinician who's attending, and they're able to carry out the task, you know, and successfully. You know, so it mustn't just stop at the central hospitals. It has to spread right across the country, and all the computers have to be able to talk. And at the same time, we also then start looking at the public health information, the gathering of public health information, the statistics. It becomes very easy. You know, so that continuous network is very, very relevant. And I'm glad to see that we are working towards the final framework, and I'm also happy, you know, to be able to say, from our experience as a pilot, before a framework, we are in a position to assist and be able to say, this works, this doesn't work, this works, this doesn't work, because we've already attempted it, and we've seen where the flaws are in the system and where you can go and be successful. I thank you.
We welcome you again, our viewers on YouTube. This is Technomag ZW, and today we are joined by Mr. Kwiro, who is the District Medical Officer at Nyanga General Hospital. So he's going to tell us the success story, the evolution, like technological evolution success story of Nyanga Hospital. Welcome to our show.
Thank you. What has happened, or what we have done, is that I've been working in Nyanga District for the last 3 years. And we have observed a number of challenges which mainly decrease or sort of compromise the issues of access. When we talk of access, we talk of availability of healthcare services to a given population which we serve. So you discover that we serve a population which some of them have economical challenges. They fail to access funds to be able to get to the district hospital where they can be able actually to be served by doctors. So we have 27 such clinics which we serve in our district, and all our patients are coming in from those facilities. So what we have observed over the course of time is that some patients present with advanced complications just because they didn't have enough money, or some patients default in terms of medications because they didn't have enough money to actually come in, be seen by doctors and get prescriptions. So we have realized that ICTs can actually help us in terms of actually getting to the people, and we've been able to set up a virtual platform which is connecting the district hospital with 2 clinics and offering video conferencing consultation. These are real-time telepresence telemedicine, which then acts as a decision support system for the clinics. So a patient presents at the clinic, and when they present at the clinic, the nurse sees the patient, and when the nurse is not so sure about how to manage the patient and also whether they can, or they are sure that this patient needs to be referred, they then have this patient be seen by the doctor using internet video conferencing technology.
Okay, so there's 27 clinics, all report to one hospital, that is Nyanga Hospital, or you have other qualified doctors that are also at those 27 clinics, and then the internet, how do you interact with them?
So the district hospital is the referral hospital for these 27 clinics in the district. So the clinics are manned by nurses, and there are no doctors at the clinics. The doctors are found at the first level, which is the district hospital, and there are 4 doctors at the district hospital. So the clinics are manned by nurses, and then when the nurses see patients that they know that these ones need to be seen by doctors, or they are not so sure about how to manage, they refer them to the doctors. So these patients have now to physically move from the clinics to the hospital, and they need money to do that, and sometimes they need to be accompanied. So now at these 2 clinics where we have connected, where we've connected the internet technology, what we've done is we've set up VSAT, very small aperture terminal systems, which use your satellite links, and we have internet with speeds of up to 4 megabytes per second, which allows video and audio transmission. So now we can seamlessly communicate with them using the video conferencing equipment and the internet technology.
Oh, wow, that's good. So how has been the response rate?
We can say that the community has actually responded to this initiative, and they've welcomed it, and they are making use of it, because at both sides we are seeing up to 5 patients per clinic, which is up to 10 patients from both sides. And we have also seen the community actually coming up with some some requests which previously they were not coming up with, because one of the clinics, they've actually requested that they could there be a drug facility, available in the clinic where they can actually buy medicines which are not available at the clinic. Now, because they know they are getting the video conference consultations from the doctors and they are getting medications prescribed, they have the prescriptions at the community level. They also now want the medicines actually to be delivered to the community level, because at this present moment, when they get the prescriptions, they are having to send over the prescriptions by some form of transport to actually have their medicines bought. So now they're actually requesting that can these medicines actually become available at community level, which to us is a show of how they're actually utilizing the service.
All right, so Doc, are you working with the Ministry of Health, or this is totally a private thing?
We are working with the Ministry of Health, we are working with the Ministry of ICT's Postal and Courier Services, and we are also approaching other partners through the government to actually come in and assist. Otherwise, this is actually a government initiative, because we are working for the government. So we are working with the Ministry of Health and we are working with the Ministry of ICT and Postal and Courier Services.
Oh, all right. So, well, thank you. What's the vision now?
The vision as we go forward is that we need to have this setup working in other areas within the district of Nyanga, because these two facilities that I've talked about, they are not enough. We also have other clinics which are actually inaccessible in terms of which have distances which are further than these facilities that we're actually assisting. And we also know that also in other districts it's the same story. So we want this setup, or we want this system, this telepresence telemedicine system, which is a decision support system, to be working within the ministry in other districts in the country. And we are also looking even at mobile telemedicine units, which would with this I'm referring to vehicles which are fitted with ICT equipment and internet into them, and this vehicle can actually go in an area where there is no clinic, and then they actually start seeing patients, and then they are connected to medical professionals who can actually assist maybe the nurses who will be moving in those kind of vehicles. So we are looking at these applications now, looking at certain applications adding on to this kind of service. We also know that elsewhere in the advanced world, you can actually perform surgeries under the guidance of specialists when you have good bandwidth available, good equipment and power is available. So we are looking at these kind of applications actually coming on, increasing the scope of services, because you can actually perform ultrasound, you can perform echocardiography, certain advanced applications using telemedicine.
Okay, thank you very much. Thank you for your time. Viewers, there you have it. We meet again next time.
Quickly following up on the currently happening eHealth framework, we've managed to catch up also with Parinyatwa Hospital Director for Operations, Mr. Mdenda. Say thank you so much for taking your time to join us. Thank you. We are greatly honored. Right, we understand that Parinyatwa is also managed to have most of these eHealth facilities already installed. Maybe if you can help us for the benefit of our YouTube viewers, what has really happened and what do we have as far as the eHealth implementation is concerned? What has been done at your hospital?
Okay, correct. We are privileged as Pari that we host one of the biggest telemedicine facility, courtesy of Government of India, which is it's a fantastic project where doctors or health workers would then make consultation with colleagues from 5 countries, major countries in Africa, and about 11 super hospitals in India, where issues to do with radiology, issues to do with lab, there's an exchange of information. Okay. And then we've got other systems in place, the lab information management system, which enables the laboratory to process the samples, and then information is transmitted to the wards. So there's no need for doctors or other workers to walk from wards to the lab to pick up the results. So results are sent to the wards electronically. We also have what we call a PAC system. This is again to do with the images, X-ray images. So an image is taken, an X-ray image is taken, and it's also the image is sent electronically to the computer where the doctor will view and make decision there.
Okay.
So, and another one is the health management system, which is called TriMed, where we do the demographics and also the billing and so forth. So all these systems are in operation, and we are privileged to say we are one of the champions. And there's one which perhaps you may have heard from Chitungwiza, the SAPS is being rolled out to Bari as well, but I could put it at 20-25% at the moment. So we have got a full package of these e-health systems.
Interesting. I understand also during the discussion inside there were some points that were of concern to us, especially issues of resistance, doctors, or I don't know what these patients, or maybe the system itself has been facing considerable resistance. What are your sentiments towards that?
Telemedicine, as I said, is being hosted by India. So there's that kind of resistance from our local guys that perhaps there's nothing much that they could learn from India. But we've noted of late that India is a powerhouse in terms of the medical field, in terms of ITs, in terms of drugs and so forth. So
why is there resistance then when we all concur that they are the powerhouse?
Well, I'm sure it's about people wanting anything that comes from the West, anything coming from the other side of the world. There's some kind of initial resistance, but I'm hoping going forward people will catch up.
Okay, all right. So, to your own understanding, to what impact? What impact have you managed to see with the e-health? Has it been affecting anything that you can measurably speak of?
I think the paramount thing is efficiency. Yeah, I mean, there's efficiency, Usually, as I said, of the lab management system, people used to walk. I mean, if you look at the size of Paris, big. So people has to walk from one end to the other where the laboratory is. So with the lab management system, there's efficiency and the results are sent